Hi there, it's Christopher Westfall. I'm a Medicare insurance agent and I specialize in the Medicare world. Today I want to go over a new article from the New York Times that reviews how Medicare is dealing with the coronavirus, especially if you're on original Medicare versus a Medicare Advantage plan or maybe a Medicare supplement plan. What's happened in the meantime is the president signed an executive order declaring a state of emergency and directing the Center for Medicaid and Medicare Services, that's CMS, to do certain things as it pertains to the coronavirus. So we're going to go over what those things are. It's a pretty good article from the New York Times, which is not one of my favorite places to go for news usually. But this article did break down those three categories: original Medicare, Medicare Advantage, or Medicare Supplement, as it pertains to the coronavirus specifically. So let's talk about it. If you have original Medicare and you need a test for the coronavirus, it is no charge. Typically would be covered under Part B, that's everything outpatient for services, and that's covered at no charge just because of this order. That also has been adopted by all the Medicare Advantage companies. They have options, as you'll see in future things later down the road here, but on this particular item, that is testing, they don't want anyone to worry about where they're going to get the test done. As long as the provider accepts original Medicare, your Medicare Advantage plan should be paying for it, and what facility does the test or what the test costs. They don't want any roadblock to be in the way of you getting a test if you think that you need one. Medicare supplements go along with original Medicare. So whatever original Medicare says you need, you can have, with no referrals, no requirements for a specific network of doctor or anything like that. So no cost across the board with the testing. That's a good thing. Now, what was formerly an option for Medicare Advantage is no longer an option. So at the beginning, the Medicare Advantage plans had an option of waiving the cost sharing for the provider visits that has to go along with the test. But right now, based on the latest law that was just signed into effect called the Families First Coronavirus Response Act, it waives all deductible and co-payments and co-insurance for testing and that provider visit, no matter where you go. Good article on that is from Medicare Rights Center at medicarerights.org. You can check that out. So what happens if you have to go into the hospital and you have the coronavirus? This could be a 5, 7, 15-day treatment course depending on your complication level. On original Medicare, if you have original Medicare, you have to pay for the hospital admission. It's one cost, a copayment for every 60 days in the hospital. So if you're in the hospital and you're in there up to 60 days, that's going to be just one cost. It's just one cost for the whole thing. And right now, as of 2020, that cost for a Part A hospital admission is $1,408. That's it. Skip over to the Medicare supplement, which I said before goes along with original Medicare. Original Medicare, remember, lets you go to any hospital in America. Any hospital that accepts original Medicare, which is all of them, you can go, does not matter. We have a lot of friends in the RV community. They're recreational vehicles or motor coaches and RVs of all types. They go around the country, all over the place, some of them full time. And they're concerned right now. They want to know, what facility can I go to? Well, if they have real Medicare, original Medicare, and or a Medicare supplement, they can go to any facility that's close to them. Does not matter. And we're going to talk about that. So a Medicare supplement, the plans I'm going to focus on in this webinar are Plans F, Plan G, and Plan N. Those are the primary Medicare supplements bought in America today. Between those, they encompass more than 95% of the plans sold. We're talking about Medicare supplement, Plan N, Plan G, or Plan F. On all of those Medicare supplement plans, you're going to pay absolutely zero when you go to any of these hospitals. So original Medicare, you'd pay $1,408. A Medicare supplement goes along with original Medicare and pays that $1,408 per admission charge. The Medicare Advantage plan is not so clear. It depends on your plan. And many plans, as you'll see, cost you more than $1,408. So let me ask you this question. If you have original Medicare and nothing else, no supplement of any kind, your limit on going into the hospital there is $1,408. It's the Part A copay. But if you have a Medicare Advantage plan, typically a zero premium, maybe an HMO plan or PPO plan, it could be more than the $1,408. So what's the purpose of having that versus original Medicare? Well, this is an article done by the Kaiser Family Foundation. They do a lot of research as it pertains to health insurance. And you'll see the tracks here in blue indicate the amount to which a Medicare Advantage participant would have to pay more than the $1,408, more than if you had nothing at all, no supplemental insurance whatsoever, you just had original Medicare. That would be, on this graph, that would be the red line. Medicare Advantage for a 5-day hospital stay averages 50% more than just having nothing at all. A 7-day stay, 64% higher cost than having nothing at all. And a 10-day stay in the hospital, 72% more than what you would pay if you had nothing at all. But remember, on a Medicare Advantage plan, you have to choose a network hospital. That's the biggest thing of all. So if you are traveling across the country and you have an emergency, the emergency says now you can go to the closest facility. Once you're stabilized, it's no longer under the emergency order. Once you're stabilized, you'd better be in-network somewhere or get yourself to an in-network facility somewhere for the recuperation stage, maybe for the acute care afterwards. And we're going to look at that too. So I just want to point out the differences. This is not me saying it. This is Kaiser Family Foundation that says half of all Medicare Advantage enrollees would incur higher cost than beneficiaries with just original traditional Medicare for a 5-day hospital stay. And the coronavirus is affecting people where they're staying in the hospital more than 5 days. That's pretty much a given. So what it says in the New York Times article about, well, how does Medicare Advantage treat people that are in the hospital? It depends on the plan. So I took the liberty of looking at some plans here in my area, in the Charleston, South Carolina area, looking at the plans and how they would be treated if someone had maybe the coronavirus and they're going to a participating hospital and they're going in for the full ride, right? Remember, again at the bottom, original Medicare would have been a worst case scenario on a hospital admission of $1,408. Having a Medicare supplement would have paid all of that for you no matter where you go, and you've got the freedom to go anywhere. So we looked at the Humana Gold Plus plan. It's $298 per day for days 1 through 7. That means for a 7-day hospital stay, this plan in this location under these conditions would cost $2,009. That's a far cry from having nothing at all and having original Medicare. And this, again, is if you follow the rules of the Advantage plan. The Allwell Medicare HMO is only $350 a day for days 1 through 5. So day 1, that's $350. Day 2, that would be $700. Day 3, and so on, up for a maximum reached at the day 5 part, which was $1,750. That's only $300 more than having no insurance at all, just having original Medicare. And the WellCare Elite HMO, which is one of their better plans, $275 a day each day for up to 8 days, so a total of $2,200. Again, we're comparing what happens if you're under full hospital admission on a Medicare Advantage plan versus having original Medicare, where your exposure would have been $1,408 maximum. So, network restrictions. On original Medicare, there are none. There never have been. You can go from coast to coast, any provider, any specialist that accepts original Medicare, which is most every provider out there. On the Medicare supplement, there have never been any restrictions because, again, remember, the supplement goes right along with original Medicare. Whatever original Medicare says you can have, the supplement just goes right along with that. Whatever original Medicare approves, you go right along with that. So, CMS has advised Medicare Advantage plans that during the crisis, this is a quote, they must cover services at out-of-network facilities that participate in Medicare, just like original Medicare does. And this has never before happened, folks. This is not the normal course of treatment for normal diseases, influenzas, those kind of things. But during this crisis, CMS has advised them that they should cover all out-of-network facilities that participate in Medicare and charge the enrollees affected by the emergency no more than their in-network rates. So will they do it? I certainly hope so. They're under orders that they should do it. Is it going to be a pain? Maybe so. Skilled nursing. What happens after the emergency part's over? After you're stabilized and your doctor wants to make room in the hospital by moving you to a skilled nursing facility. Well, on original Medicare, there's no cost for that. Up to 20 days of skilled nursing, there's no cost. I did a video recently, you should really watch that, on being under observation as opposed to being admitted. You need 3 full overnights of under admission, technically, before you can get skilled nursing covered by Medicare. And I talked about it's very important that you strongly advocate for your own behalf or some senior that you know that's under these circumstances. If they're in the hospital under observation and then need skilled nursing facility coverage, it's not going to be covered unless you follow the rules. The rules are not done by you, they're done by the hospital. So you need to not be quiet. Don't be silent at all and say, oh, okay, I'm just under observation. Somebody needs to be the squeaky wheel that gets the grease and insist that if you're going to be in the hospital for 2, 3, 4 days, it's not under observation status, just on the chart. It's fully admitted in case you're going to need skilled nursing follow-up afterward. If that's done correctly, then original Medicare pays for all of it for up to 20 days at no cost to you. Same with the Medicare supplement. And again, it doesn't matter which skilled nursing facility, as long as they take Medicare patients. On Medicare Advantage, it's up to the plan. They get to decide where, when, how much is covered at all times. So an example, I looked at the Lasso Medicare Advantage plan. This is a very unique Medicare Advantage plan in the market. There is zero cost on the Lasso plan after, in my area, you've satisfied an $8,400 deductible. So after you've paid $8,400 in all of your cost on Medicare, no problem, it's covered at zero cost. If you haven't, you're going to pay for those costs at probably the Medicare rate until your cost out of pocket has reached the $8,400 deductible for that calendar year, and then yes, it'll pay for it. Medicare Advantage versus Medicare, original Medicare, real Medicare. So what a lot of people don't remember is on Medicare Advantage, you're literally signing away your red, white, and blue card for that contract year. So if you sign up for a Medicare Advantage, HMO, PPO, private fee-for-service, or other plan, MSA plan, you have, for the purposes of that year, given up your original Medicare and gone under the rules of the Medicare Advantage plan, with their network restrictions, with their prior authorizations required, with their referrals required to specialists, in-network hospitals, and the like. This specific emergency is very different, and you cannot count on this type of emergency declaration by the president, a national state of emergency, to get you out of future things that are just a part of the plan, because it just won't. Look at telehealth. Now, on original Medicare, under this order, telehealth, that's the ability to call in or video conference or Skype or anything else, maybe FaceTime on your iPhone, Zoom, meetings, whatever, with your provider, with any provider that accepts original Medicare. Now it's covered just like it would be covered under Part B. Same thing with a Medicare supplement. On a Medicare Advantage plan, they've been advised to let them do this. They've actually had the authority to do this for a couple of years on Medicare Advantage so that the government can test it out, see how it works. So it's up to your plan whether telehealth visits are required or even paid for by the plan. And of course, you probably have to go through a network doctor there to get that done. But the interesting thing is the telehealth is a really good way to go to communicate your symptoms, to hopefully take your temperature over a period of time, like every 6 hours, and communicate the length of the stay of the fever, what your temperature has been, what your other symptoms have been, what you've maybe taken toward it. Don't take ibuprofen for the coronavirus, so that your provider can maybe make a diagnosis or tell you to get down to the ER and let them know that you're coming and find a designated emergency room that can treat you for this. So on original Medicare, before it was only permitted in far away, far-flung places for people. Now it's open to everybody. And I firmly believe that this will survive the crisis. This will survive the emergency order, and this will still be here long into the future, because it's just a better way to deliver medical care. And we even have doctors, as I saw in one article, the doctor himself, he's quarantined to the home, but guess what? He's still seeing patients. How? Because he can do it through video conferencing. He can do it over the phone. That's really neat. Now, one thing that's come to light in this crisis, a lot of seniors went past working 65 years old. They went to 66, 67, 70 years old. They just want to continue working because, as we've experienced with friends and relatives, when they stop working, suddenly they have nothing to do, and, health situations hit them. So a lot of people have continued to work. Unfortunately, because of this crisis, in the first week of the unemployment numbers, we saw 3.28 million unemployment claims, which is 5 times the greatest number that's ever happened before in 1982. So what is the senior to do when they've suddenly lost their employment? They've maybe lost their health care through their work, and now they've got to go back to Medicare and say, well, I'm over 65, I should qualify for Medicare. Let me address that just for a moment. Yes, you can qualify for Medicare. If you've had coverage, continuous coverage through an employer plan, it's not going to be a problem. It's not. We can help you with that process. We do it every single day for people who have worked past their age of 65. You can call us. We'll get you the form. There's a Social Security office form that you have to fill out. Now, that form needs a signature from your old benefits people at work. We can even help you facilitate getting that form to them, fax back, whatever you need. Here's the hard part. The Social Security offices have closed nationwide. They're not seeing people coming in there. They don't want crowds of people sitting in a waiting room in the Social Security office. So here's what you've got to do. The trick is you've got to fill out the form, request your Part B start date. And again, my office can walk you through this process. Then decide what other kind of coverage you want to go with Original Medicare. The biggest consideration is this. If you have Original Medicare, where again it provides you the freedom and flexibility to go to any doctor, any outpatient facility, any hospital, from coast to coast without referrals, without pre-authorizations, without worrying if it's in a network or not, as long as they accept Original Medicare, that's what Medicare can do for you as your primary insurance. You've got to sign up for Part B, and that's a process you can either do over the phone, or you could do it in person before, or you can mail it in, or you can do it online. The caveat is, when you're over 65, you need the former employer that you're leaving now, you need them to sign off on the fact that you had continuous coverage from the time you were first eligible for Medicare at 65 up until the time that you're wanting Medicare to start. As long as you had continuous coverage in there, it's not a problem. There is no penalty. There's no waiting period. You can start Part B at any time as long as you don't wait longer than the period that's eligible for you to have left employment and then started Medicare. We can go over that with you in great detail. So it's going to need a signature. We can help you do that. When you get the signature on the form, the best way to do that is get the signature, put it in an overnight envelope addressed to your local Social Security office, because they're still in there working in the back. They just won't let you come in there. Put it in a priority mail or an overnight envelope and write urgent on there on the outside. I would write it in red and request your Part B start date on the form that's included in there, and we can get that to you. So you overnight that to the local office so that they will prioritize getting that done. It takes a human being to look at your prior coverage and say, yep, that's going to be good, and get you in the system to start on Part B. Then you can make your choice as to how you want to pay your Part B premiums. If you're drawing Social Security, it can come right out of that. Not a problem. If you want to pay for it quarterly, you can set that up. And if you want to then set it up to come out of your bank account, you can do that as well. Again, that's what we specialize in, is helping people get through the Medicare maze, figure this stuff out. So if you know someone who is affected by this tragedy, or at any time has decided to continue working past age 65, and now they want to investigate, should they go on to Medicare and get the benefits that they've been entitled to, that they've earned their entire life? Maybe they should. And many times you'll find that it's much less expensive than their contribution was at work. You'll find you might even be saving a lot of money there. One thing that we really need to look at before making that jump all the way in, if it's a decision that you have between should I stay at work or should I go on Medicare, if you're laid off and there's no choice, then there's no choice. We do the best we can on finding the drug plan. See, that's the part that most agents forget about. How will the drugs that you're taking affect you at the cash register? Because commercial insurance, employer plans, are far different than Medicare Part D. That's the drug plans that you have at the pharmacy. So we need to take a look at how will the drugs impact your overall cost if it's a choice. If you're comparing, should I stay or should I go? Should I stay at the work plan or should I go over to Medicare? We always save people money. Well, I say always, most all cases. And coming from the premiums that they paid at the work plan, with the high deductibles, the limited network and all that, we put them into a better plan with Medicare and a Medicare supplement with the freedom and the flexibility and much lower premiums than they were paying in most all cases. But the one thing we have to remember is there will be a different component to the drugs. It's not going to be the same kind of drug cost that you had, depending on your drugs, of course, and everyone's different, when you had it at the employer plan. We can help you with that. I've been doing Medicare for Been licensed now for 26 years. I think it's 26 years. And doing it over the phone exclusively, helping people from coast to coast for 12 years. I have a really good, strong, well-trained, and energetic team that through the coronavirus, they're working from home, just like I am on my laptop. And working from home using the telephone. We use little headsets here to make things crystal clear. Sometimes you might hear nature behind us during this thing going on. You might hear babies in the house. You might hear dogs barking. But we have not interrupted what we do, and that's helping seniors navigate Medicare, get on the right plan. All the insurance companies are open for business. They're processing applications. We're helping people. And the application process with us is so easy. You'll be amazed. Everyone says the same thing. Well, I can't believe that's all I have to do. I don't have to mail you a signature or anything. Nope. Not in 2020 and beyond, you don't. We make the whole process easy. So if there's anything that I can do to help you, please reach out to my office. I love it when people comment under the YouTube videos, so make sure you do that if you want to. Share with people what your experiences have been, what you've been going through the coronavirus, and engage in the community that is there. But if you need specific time-sensitive help, don't do it in a comment because we have thousands of those. If you need specific help from my office, please reach out to us. The best way is on our website, which I don't even have on the screen. What is with that? It's at the top right there, seniorsavingsnetwork.org, or you can Google search Chris Westfall Medicare. But seniorsavingsnetwork.org, we've got a contact form there that is very secure. It's encrypted. We'll go right to my team so we can get out to you in a timely fashion and help you right where you are. Of course, you can always call us too. Thanks for watching. We'll be keeping you up to date with everything that changes in Medicare, as I've always done, and the coronavirus, how it might impact you going forward if things change with Medicare. Thank you. God bless you where you are. Stay safe, and we'll talk to you soon.